Hey, welcome! It's Ashley from Demystifying Your Health. Today, we're going to be talking about high blood pressure. A lot of people have this condition and are able to live their lives fairly normally, so many don't think it's that big of a deal. But it is. It increases your chances of having severe health issues, such as a heart attack or a stroke. So, what exactly is high blood pressure, and how is it best managed? The force of blood being pushed through your arteries to deliver oxygen and nutrients throughout your body is known as blood pressure. It's measured in millimeters of mercury, or mmHgs. It has two numbers, systolic and diastolic. Systolic is the pressure in your arteries when your heart's contracted. Diastolic is the pressure in your arteries when your heart is at rest, or between beats. It's normal for your blood pressure to fluctuate throughout the day. The problem is when it remains high all of the time. This is known as high blood pressure or hypertension. There are no specific symptoms for hypertension, which is why many people don't even know that they have it until they have some sort of medical emergency like a heart attack, stroke, or even kidney failure. Some medical conditions can predispose you to developing high blood pressure. This can include diabetes or prehypertension. Prehypertension is when your blood pressure is higher than normal most of the time, but not as high as someone who has hypertension. By now you're probably wondering, what are the numbers of a normal blood pressure, let alone what are the numbers of someone who has high blood pressure? Well, a normal systolic blood pressure is under 120, and a normal diastolic blood pressure is under 80. If someone has prehypertension, their systolic will be between 120 and 139, and their diastolic will be between 80 and 89. For someone who has hypertension, their systolic will be over 140, and their diastolic will be over 90. Treating high blood pressure is done through a two-step process. The first involves medications. Naturally, your blood pressure is regulated through a variety of ways within your body. This is why there's so many different medications used to control it. All blood pressure medications are broken down into groups. Each group works on a specific component in the body, but the medications might be chemically different from other medicines in the same group. This is important because everybody's body is different. How one person's body responds to medication can be different from how another person's body responds. This is why doctors often have to tweak blood pressure medications so much, because they're trying to find the right combination that works for you. The other part of the process is lifestyle changes, which are also preventative techniques. There are 4 main lifestyle changes that you can use not only to treat blood pressure, but also prevent it. The first is eating a healthy diet. This means your diet should be low in salt, total fat, saturated fat, and cholesterol, while being high in fresh fruits and vegetables, lean proteins, and whole grains. The next is getting regular exercise. This is key. Even a brisk 10-minute walk 3 times a day is better than doing nothing. Just remember to talk to your doctor before starting any new routines. And the third is also vital. This is not smoking. Whether it's cigarettes, vaping, or anything else, don't do it. And the last is limiting the amount of alcohol you consume. By implementing these changes, it can have a significant impact on your blood pressure. The impacts of high blood pressure can be far-reaching. However, with a few simple interventions, it can make all the difference in your life. If you'd like to know the chances of you having high blood pressure, go to the American Heart Association's website and find the High Blood Pressure Risk Calculator. Stay healthy.